Good morning, everyone. Welcome to Third Thursday. My name is Tim Stark, and want to just give you a few reminders before we introduce our speaker for today. Be sure to sign in so we have an accurate list of who is here. And there's also, in regards to the paperwork back there, there's a survey as well. I went through all the surveys from last month, and it's really helpful, and I'll get to them here in just a bit. There's also a half sheet of paper back there. So those of you that have a CCSP or a Diploma in Sports Chiro, grab that half sheet of paper, save it, because at the end of the year, if you do get audited for continuing education, you can turn in those hours to the American Chiropractic Board of Sports Physicians. Regarding the comments from last month, they were very helpful, so if you have any ideas and suggestions for future speakers, please speak up. Most of the comments were leading towards concussion and having an interest in hearing more about concussion. And in fact, 2 months from now, we do have a speaker speaking on the mental health issues related to concussion. So I think that'll be really interesting. Next month, just to forewarn you a bit, next month we have Dr. Matt Tronson, who's one of our Human Performance Fellows, and he'll be talking about primary care in a high school setting. So I think that'll be a really interesting topic. Let's see, and then after Dr. Tronson's next month, and that's when we have Dr. Beth Antoine, who's going to be talking about mental health issues with concussion. And then we have Dr. Craig Couliard after that, who's going to be speaking on sport hernias. And then after that, I believe we have Dr. Greg D'Annunzio, who's the director of our Swery Center downstairs, who's going to be talking about gait analysis and biomechanic analysis and high performance athletes. So I don't want to take up any more of Dr. Williams' time, and I'll let him introduce himself. I'm sure he can do a better job than I. And thanks again for coming. Be sure to help yourself to the vittles on the side. Thanks.
Yeah, thanks, Tim. I think I know most of everybody here today. Just a quick review. Dr. John Williams. I've been working with athletes now for about 12 years. We started out with St. Agnes, where in Concordia, where we have our fellows working as well. We've got a lot of experience working with them. It's been a lot of fun, but at the same time, it's been an ongoing learning journey since then. So, because we have limited time, I want to just do a quick little review. We're going to talk a little bit about wound care, and then we'll get into some of the conditions that you're going to see. We're in the middle of wrestling season, so I want to talk about some of the skin conditions that you might be running into and how they're going to be handled. Quick review, you can go take a look at this stuff later. I've got some of the occlusive materials up here, the Tegaderm. We have the OptiSite Flex, that's a roll. We've got some of the absorbent type of gauzes, different types, wound things, wound blood control. We got the hypoploid bandages for absorbing moisture and exudate as the wound is healing over, and a couple of them that will call cover and yet protect. You're going to start seeing a lot more silver being used for the simple reason that with antibiotic resistant bacteria, it's not resistant to silver. So you just got to remember with silver that it's not the silver metal itself, but it's the ionic form of silver that's actually detrimental to bacterial structures. It actually penetrates through the cell wall, adheres to the cell wall, then penetrates in and disrupts their metabolic system, which causes them to die off. But we've got, you're going to start seeing more and more bandaging and dressings that carry silver with it as well too. So for us in the sports world, out there on those fields, we're going to have wounds, especially abrasions, stuff like this, where it's going to be contaminated, it's not infected. So, but at the same time, something like this can act as a nice prevention. Clean it up, put something on it to make sure we're not going to cause infection, and then pull it off afterwards. So let's just take a quickie review of some basic wound care, physiology of the wound care. As you remember, hemostasis typically is the first stage in which we're just getting blood clotting. As soon as that blood starts hitting the air, it does start clotting. It's congealing. Next stage is the inflammatory stage, in which things start, we got our phagocytic responses, and we start seeing our inflammatory fibrin and other materials that will stimulate increased flow into the area. Your proliferation phase, your granulation phase, this is where we'll also see the development of arterial structures and venous structures being replaced. Contraction of the wound by your myofibrils, and then maturation phase is the remodel. This can take, depending on the tissue, anywhere up to years, up to 1.5 to 2 years, depending on where we're at. First, with the first injury, first thing we want to do in those first 24 to 48 hours, keep it moist. This will keep it from drying out, cracking, splitting, and if we can control it and maintain some moisture over top of that wound, it'll heal better, it'll have less scarring, be more comfortable. After about 48 hours, then we want to keep it dry, keep water off of it, allow it to go through its standard process. After about 24 hours, 48 hours, we can start washing. Real light, especially around the area, pat it dry. You don't want to rub it off and start breaking up that scab that's being formed there. Topical agents, many times early on, it's not a good idea. They can actually cause growth of bacteria because most of our antibiotic creams are petroleum-based. So, however, they do reduce the crusting, they do reduce the swelling and the drying, but this is where I'd rather use something like your silver products at this point in time. They're not quite as drying. Whereas your petroleum-based, they can interfere with it. They'll allow for a growth if we have any type of contamination underneath it. It'll kill off some of it, but at the same time, it can allow for some colonization to take place. Watching. Infection is the biggest thing, especially since if we're working with athletes. Injuries take place, wounds take place, outdoors, even in the gym, whatever. We're going to have chances of contamination and infection. So we do need to monitor these. And just remember that these infections, if they stay local, not a big problem. We can take care of them pretty easily. But it's when we start getting those wounds and we get the stuff traveling up the arms. Just remember with some of that cellulitis and those infections, they can spread up the arm in hours. So if we got a nasty wound infected in the hand, I've seen it go within 4 hours from the hand to the armpit. So just be aware that we got to move with that. And here's some of your wound closure material. I typically carry or used Steri-Strips. Many times it's just a lot easier, it's a lot quicker. You get the wound cleaned out, seal it over, they're good to go. We can put them back in, we can let them play again. Wrap it up, seal it off, put your Tegaderm or your occlusive bandage over the top of it, wrap it up. If the parents don't like it, we've got it closed up, we've got the bleeding stopped, we're closing it. So let them get off to the hospital. They have up to 5 hours after we close it for the emergency room surgeons to open it back up and re-clean it and reseal it or stitch it, whatever they want to do. If they wait more than 4 to 6 hours, then they actually have to slice it back open, and it's not a good idea. So typically they don't. One thing is, as you get known to the parents and to the emergency room docs in the area, typically if you send someone in, a parent brings their child in, they're going to let it stay if it's done, if you got it nice and cleaned up, and we got a good seal on it. Here's just a few more things. You're going to see all sorts of different bandages and stuff out there. The occlusive ones we're going to be using especially for ringworm, molluscum, a couple other viral conditions that we can allow players to play with. Your colloidal ones, or hypocolloidal, or hydrocolloidal rather, these are the ones that will have, where the wound has an exudate, little drainage. We need to absorb that and protect it. So we'll use those for that. And here's different brands of your silver compound, and here's the wound cleansing material that I carry with us for wound cleaning right on the site. It's antimicrobial, it's not a true antibacterial. The reason why I use the antimicrobial is because we're in a stage of contamination, not in infection. And at the same time, our skin usually does have, or I shouldn't say usually, always has bacterial content to it. So we don't have to have it completely sterile when we wrap it up. But this will clean it out real nicely. It also doesn't sting. We can absorb it off real quickly and close up a wound. Whereas if you use your iodine or some of the others, they actually sting and can be disruptive to healing tissue. It's nice for cleaning around, but for actually getting inside the wound, it's very difficult and painful. It slows down the process of getting our athletes back into play. So let's take a look at some of the skin conditions now, and we'll just go through real quick. Blisters. Blisters and your abrasions, we can take care of those. One of the things for blisters, 18 gauge syringe needles, fantastic. You can pick these up at the pharmacies. I like them because they got that nice razor tip to them. Slide it in the base of the blister. You slide it in through the side, use your sterile gauze to drain it out, and then you can put your moleskin or what other material that you have over top of it to protect it. Get it back into play. As long as we've got it covered and they're comfortable, we can get them back into play. Needles, sewing needles, and other things that everybody else uses, not a good idea. I'd rather have a nice sterile needle that you can open it up and get a good drain off of it with. Your abrasions, again, clean them up. Your silver compounds or your silver dressing goes over these nicely, and then you can use your vet wrap or other things to tape it down, hold it into position, and allow them to get back into play. Because with these, they will seep, and those silver bandages will have absorbent qualities to them as well, and prevent any further growth or colonization taking place until we can get them out and really get it cleaned up. Biggest area where I had problems with this is with softball and baseball. Sliding in, opening up knees, opening up elbows, and those things then just continue to seep because they're under constant motion. But with these bandages, they can fit around it and they will move with them a little bit. So it makes it nice and easy, and you're not always going to get all that sand and grit out of there at the game. So, because they want to get right back in. So that's the reason why I would start recommending using the silver just to prevent any further contamination until they can get home. What we're looking at, when we look at communicable diseases, these are going to be our skin diseases that we have to worry about. I've got the NCAA manual out here, chapters open to their skin conditions. We're going to talk through those pretty quickly here. But the National Federation of High Schools typically follows that. Minnesota High School League follows those conditions as well. So for your wrestlers and other sports, they've got their guidelines set for what they want to see. Here's your Minnesota High School League reporting form. So if you have a kid that has a herpes virus, you got to make sure it's cleared off, and here's your reporting form to do that. You have a kid that comes down with molluscum. It's a virus. It's a pox virus. We get an infection as long as those nodules are on the body. They cannot play, especially with wrestling. But if we can clear them off, we're good to go. I'll give you some of those exceptions for that. Looking at bacterial infections, NCAA, yes, the National Collegiate Athletic Association, and our high school leagues follow it. Bacterial infections. No new lesions within 48 hours. So basically, if we're looking at an impetigo, you know how that kind of spreads. You get a little spot, and then the next day or 4 or 5 hours later, you got another little spot. So as long as we don't have it spreading for over 48 hours, we're good. They also have to have completed 72 hours of antibiotics. Now, here's the rub. NCAA, Minnesota High School League, all require MDs or DOs to sign off on them. So they have to use prescription antibiotics. Now, as DCs, yes, we can put them on our antimicrobial herbals and things like this in between, but make sure they are on antibiotics. Otherwise, they cannot be cleared. So this is just one of those difficult situations. And again, it's the idea that you do not want to be responsible for spreading impetigo through a team. Yes, there's good ways of treating impetigo, and typically you can get it cleared off within about 48 hours. But if somebody catches it in between and you're doing it alternatively, you're going to be liable. So get the antibiotics and use our natural therapies alongside of it. So the crusts that form, or the seeping wounds that form with your impetigo and other infections, they've got to be dry. They've got to be crusted over and scabbed over. So, and then no bacterial infection active bacterial infection shall not be covered to allow a participant to play. Again, even though the impetigo is only in this area here, that can be covered. It doesn't mean that 2 hours later something won't show up on the other side of the face. So with bacterial infections, everything has to be closed off and finished off before you get them back into play. Your impetigo, this is very common, and it goes through families, it goes through teams like wildfire. Very, very contagious. It's a staph infection. It forms the crusts and they seep, so you're going to get a little, it looks like a very shallow ulceration, and then it starts seeping, so you have a lot of serous material there. Now remember, with serous material, it's also full of glucose, so it does tend to stimulate further bacterial growth, and that's what allows it to spread. Also, because of the crusting, it gets very itchy, so the person is going to be scratching, picking it off, and then he goes scratching someplace else. Now he's spreading. So this is very, very contagious, and it needs to be cleared off. Typically, you should be able to clear impetigo off with antibiotics and with alternative stuff within about 48 to 72 hours. It's very responsive and very quick. The stuff we have to worry about is the cellulitis. This is going to be a deeper infection. This is one that's going to be down underneath the skin. It's going to be red and inflamed. Whereas with impetigo, yes, it's going to be red, but it's not really inflamed, and it's very seepy. It's very superficial. This is deeper. Even though it's deeper, it's still a bacterial infection, and if we get a cut or a break in the skin here, it's going to spread. The other thing that you have to worry about with cellulitis is that it can now start moving into the lymphatic system. Now we've got big problems, and it will spread throughout the body and into a septicemia if it's not controlled. So again, get them out of there, get your antibiotics for it, and take care of them. Other things that are going to come about, and this is going to be with more with hockey, football, rugby, things like this, where you're going to have material that's going to be rubbing against it. The first introductory slide, there's a judo tournament that took place here in Minnesota. Those gis, whether it's judo, karate, mixed martial arts, what have you, those gis tend to rub and are going to be irritating the skin. You irritate the skin, break off a hair follicle, now you can develop a folliculitis. As that folliculitis grows and spreads to surrounding follicles, hair follicles, now you're going to end up with a carbuncle. So you've got a collusion of follicles that are all infected. Again, staph. Folliculitis, you catch it early, very quick. Hot compresses. Get those things to rupture, clean them out. Topical antibiotics will work. Again, for safety's sake, so that you're not responsible, have the parents give the kid a topical antibiotic prescription. Use your silver washes and your herbal washes that you're familiar with to clean the area, but then put the prescription over the top. Carbuncles, these are going to be much deeper, so these are going to be right down into the hair follicle itself, so they'll get down into the dermis. These carbuncles can get down into the hypodermis, down into the fatty tissue. They're much deeper. They're going to take much more heat, longer time to get them cleaned out. These, in some cases, depending on the size, you may also want to have your oral antibiotics as well. Do whatever you can to get these things cleared off as fast as you can. So this is where I would recommend blending both your antibiotics plus your antimicrobial stuff, our herbals, our silver, and other things that we can use, and help clear off pretty quickly. Erythema. This is a corneum bacteria, again, bacterial infection. It's deep in the skin. It does affect the melanocytes, and this is why you get that browning color to it. So it's an irritation down into the dermis and into the melanocytes, which is going to give us the color. It spreads. This is one of those bacteria that likes to get into those nice warm folds, grows, develops, and the other thing with this is you may end up with a little bit of an odor from it as well. Woods lamp, those of you that are going to be looking at skin, Woods lamp is a nice, easy tool to use. Get it into a dark room. All this is dark light, black light, but it will help to identify some of your fungal infections, some of your different bacterial infections, your vitiligo, and a couple other things. Very easy. That lamp there, you can pick it up off of Amazon for about $35. Looking at some of the things, you may need to get out a magnifying glass. A 10 power little magnifying glass. You can pick these up on Amazon for about $3. But it does help you look at things and see what's going on with the skin. Those are a couple of tools that will be very, very handy. Hydradus suppurative, again, this has to do with the sweat glands. Eccrine glands are the sweat glands that are all over our body. The apocrine glands are the ones that are typically in the axilla, down in the genital area, and these are deep. These will actually have tails that will also go down into the subcutaneous and down into the hypodermis, down into the fatty tissue. When these things get infected, they get a very deep, boring pain with it, a very deep infection. These can many times will actually form an abscess, which will have to be sliced in order to be drained. And then because if you get a nice deep abscess, those things need to be packed so they can heal from the inside out. Whereas if you just slice them and you got a deep infection, it's all open in the bottom, you got a little cavity, heals from the top, you're going to end up with a sterile or another abscess back in there as well. So these are much more difficult. This one responds pretty well to antibiotics, both oral and topical. You can clear this one off relatively quickly. These are going to take much longer because you've got to heal that abscess from the inside out. So these, it might take a couple of weeks before they can get back in. Best thing is to monitor this and monitor the kids that have a susceptibility to developing these type of abscesses. Keep them clean. Prevent it from happening. So again, use your different types of silver washes, herbal washes, Celludyne and other things that over the counter that you can get as well. You want to prevent these from getting developed. Because if this is one of your top wrestlers or a top lineman, he's done until you get those infections cleared. So monitor them, prevent it from developing up. And these tend to be run more in the family, so there tends to be a genetic component to it as well. So if dad had it, mom had it, start thinking about it with the kids as they come up through as well, and monitor them. They will typically one of the big things that they have problems with is the body odor that's associated with them. They do get pretty stinky, and these kids are going to be real self-conscious about it. And what they're going to try to do is cover it up and hide it. As the coach and talk with parents, find out what's going on. Here's your antibiotic-resistant bacteria. Here's what the NCAA says, and what Minnesota High School League is also doing. They're looking at the staph-resistant bacteria. Typically, if it's methicillin resistant, we're probably going to find other antibiotics that it's resistant to as well. So, and this is one of the reasons why they're going to start seeing more and more silver compounds being used. Trouble is high mobility or morbidity with this as well. So, be careful. They penetrate down through, you get into the vascular system or into the lymphatic system, now you're going to end up with a septicemia. Anytime that you start thinking about this, anticipate the use of IV antibiotics. And they're typically going to use triple antibiotics on 2 or 3 different types of antibiotics blend together. Skin abscesses, your carbuncles that don't heal over very quickly, start thinking antibiotic resistant. This is where we can also start culturing things. You have something that's growing, it's slow responding. If you don't see a substantial change within about 48 hours, order a culture. Find out what it is so that you and then have it sensitized. That way you can prescribe or have the prescribing doc prescribe the appropriate antibiotic, not a general antibiotic, but a specific one for that particular infection. If you want to be real safe, as soon as you see an infection, get it cultured. Culture it out. Don't worry about it. If the parents realize that these infections are going to stop their sons or daughters from participating in a sport, they're going to pay for the culture. I mean, a culture runs, what, $25? It's not that big of a deal, but if you can get that culture, find out what it is, and be much more aggressive with the antibiotic treatment, the team is going to be happier, the athlete's going to be happier, so are the parents. Prevention, keep anybody that's playing with any type of infection away. Any skin that's abrased, injured, cover it, protect it. Make sure they know how to clean any type of injured tissue. So if they got a little abrasion, make sure they know what to do. It's not just soap and water, but they want to go back over with some antimicrobial substance just to clean things out, protect it, keep it from getting on. And then overall, good general hygiene. High school kids are notorious for not showering, skipping showers after practices, running out after the game without the shower, heading home, then going out and going to bed and not getting up and taking the shower until the next day. Yeah. And then sleeping in the same bedclothes unless mom changes them for them for weeks on end. So be careful. Again, proper hygiene. The other thing with proper hygiene when you're dealing with infections, Imbutago, daily change bed. Things that are highly infectious, change bedding daily. You don't want it on there so it can spread infections again. And again, if we do come across the MRSA, it is reportable. We have to report it to the CDC and the Minnesota Department of Health. So just be aware of that as well. Now, this is another reason why it might be best to refer them over to the MD or the DO. Let them do the reporting. They've already got the forms there and everything else. It'll be a lot quicker for them to do it and get the back antibiotics that are needed and everything else. else. And we can take care of the hygiene and the in-between stuff. But here's a nice picture of a little bit of a small MRSA infection. Again, it looks like a carbuncle or an infected furuncle, or a folliculitis, but it starts seeping. So it's similar to your impetigo. Many times with the MRSAs, what it does is it starts rupturing from the top and starts seeping out a little bit. So you get that secondary response of the crusting. And it's that crust that will allow it to be scratched and spread around the body. So again, highly contagious. Acne is not, even though we are dealing with a acne or a bacterial infection, this one is not contraindicated and will not prevent an athlete from playing. The big thing that you have to worry about is that we've got proper hygiene. They do not share equipment. But according to the NCAA, Minnesota High School League, acne is not an infection that we have to worry about. It's typically not contagious from one person to another. Again, general good hygiene, protect themselves. This is one thing where equipment, I would use the silver washes on their equipment. Go ahead and get some of the colloidal silver, your nano silver, or some of the other silver alginases that are liquid form. Wipe everything out. Wipe down the patterns. Let it air dry. Basically, they're all water-based. They're going to air dry. So it's just going to help prevent anything and keeping these kids from getting deeper and further breakouts. One of the things that Dr. Stark and I have talked about in the future is we'd like to get some ozone equipment in here so we can actually start moving it around to the high schools to sterilize equipment. That's hopefully still in the game plan somewhere down the road. But acne is one that we want to work with. Also, the ozone does tend to destroy bacteria, gets the odor out of stuff and everything else. Tinea infections. These are your fungal infections. Whether it's a tinea crucis over the body, jock itch, athlete's foot, whatever. It's a fungal infection. They have to be under treatment for 72 hours before they can be allowed back into play. Also, those areas need to be covered. Now, if this site, NCAA recommends the OptiFlex, OptiSite Flex, because it's very easy to use. It's a roll. So you can roll it out, cut whatever you need, put layers over the top of it. It's not as expensive as the Tegaderm. This size Tegaderm runs about $2 to $3 per sheet. This roll, 9 feet long, 10 meters. It was about $16. So it's a lot less expensive and it'll still cover things over for you real nicely. So with your fungal infections, they tend to stay pretty localized and they do not spread as well, especially after being on medications for that 72 hours. You can cover them or bring them back in. There are some of your different types of lesions. There's your crucis, your body, there's your athlete's foot, there's your jock itch, and here's your vesicore, tinea vesicore, which basically destroys the melanocytes and gives you those white spots. All of them, topical medications, if they're severe and not responsive to those medications within 72 hours, they can also go then to an oral antifungal, which will compound it. For alternative therapies for tinea infections, you all remember good old DMSO. DMSO mixed with tea tree oil does a fantastic job. So to help clear it off real nicely as well. So you can use that in between your topical stuff that is prescribed. And again, use the prescription stuff. That way you're covered. The medics are responsible for it. You're not going to be responsible for anything that can spread through. Here's your different types of, there's your different features for it. Athlete's foot, red, erosion, scalings. So you can read that later on. Herpes infections. Symptoms are gone. No new lesions. Remember, with all your herpes infections, you're going to have those little vesicles. They're going to be those little fluid-filled vesicles that look like a little tiny blister. All your different types of herpes infections have those, and that's the sign. And so, in other words, no new blisters for 3 days. Everything is crusted over. This is, since it's a viral infection, not bacterial. Once everything is crusted over, basically that virus is not active. So it's not going to be spread. As long as you have new vesicles, that's when it's going to be able to be communicated. Recurrent infections, these are ones that will have ulcerations to them. Now, once they're dried out and solid and sealed, then we can start moving them back in. But these ones typically take medications for up to 5 to 7 days. So beware of that. And here's some of your different types of herpes infections. You've got the ones around the mouth, herpes labialis. We've got the herpes gonatorium. So basically you're going to be in areas of friction. You've got the regular zoster. Here's your genital. And here's a whitlow. So whitlow typically tends to be on the fingertips. Again, it'll have those vesicles. The area will be red, it'll be itchy, it'll be irritating. But those are the primary ones that you're going to be dealing with. Molluscum. This is a pox virus. Very contagious, very common. Medically is considered self-limiting, but that self-limiting can be anywhere from 6 months to 2 years. And as long as these little dots are there, it's contagious. Now, if they're localized, so if we have an area just this size, that's the only place that it is. As long as they're on medication and the area is covered by clothing, you can put occlusive dressings over the top of it and they can participate. If it's a wrestler or some sport where the skin is shown, they cannot, even if you put the occlusive dressings over the top. So this is one, as long as it's underneath clothing with occlusive bandages or dressings, they can play. But if it's open, they cannot. So if it's an area where it would be rubbed, even with occlusive dressings and everything else, they cannot participate. So if it pops up, and these things are very contagious. Where you're going to see this most commonly is in the young kids, grade school to middle school. That's where you'll see it most frequently. If it does pop up in the high schools, catch them early. These are very localized infections. You scratch them and break the top, yes, then you'll spread it. You rub up against somebody and the top breaks off a little bit, it's being spread. So for quick treatments, what they'll do is surgically remove these things. Just a little snip in each area. But that's the only way that they'll do it, be able to get back in real fast. So with molluscum, you do have to be careful because it does spread very quickly because it ends up having a very thin layer of skin over the top, and they will rupture on you. Your warts. Again, these are viral. They are contagious. with plantar warts or any warts on the body, these are not contraindication to play as long as they can be covered. Inside shoes, not a problem. But if they're on hands, they need to have occlusive dressing over the top and then wrapped. And as long as it can't be torn off during whatever sport it is, they can continue to play. The trouble with these is they are viral and they are transmitted. They can be communicated. Some of the things that work very well from an alternative point of view, let me get my note back out here. It's a product called Mayapple from Hawaii Farm. Mayapple has some very nice qualities that tend to be cytotoxic to the virus. You put that over the top and then use your duct tape over top of that. These viruses need to be in an aerobic situation. Duct tape puts them in an anaerobic situation, which allows them to die off. Okay. So the duct tape does work nice, but the Mayapple works even better on top of that. If you don't have the Mayapple tea tree with DMSO, drives it in, or a DMSO with salicylic acid, drive it in there and then put the duct tape over the top of that. So we got a couple of different alternatives. Last couple of things, scabies. It's a little mite, burrows up underneath the skin, lays its eggs, then as the little critters start developing, now we can start seeing movement underneath, so they'll burrow underneath the skin and everything else. Again, these are contagious. Many times with scabies, you may only have 2 or 3 of them on your body, but they'll burrow in, lay their eggs, come out, crawl over, burrow in someplace else. So you might have a number of burrows in the area, but you may only have 2 or 3 critters. Now, they'll jump and move from one person to another. So again, you have these, hygiene, bedding changed daily, get your topical prescription material to get these cleared off, and then use your a good antimicrobial wash just to keep things going. Ingrown nails, oh, by the way, they have to be on prescription treatment for 24 hours, and actually they have to be on prescription treatment many times, that'll be for about 3 days, and then 24 hours after the treatment is done, then they can go back into play. So they may be out anywhere from 3 to 5 days before these things are completely considered clear. Ingrown nails, even though we may be dealing or can lead to potential infection sites, these are not contraindicated to play. Basically, let them play as long as they're capable and can stand the pain. Best thing is to take them into the medics, let them slice that nail and cut that thing out, and then pack it to let it grow back out. There are some neat treatments where you have ingrown nails on both sides, where they'll actually take a device, spread it, and then pack it underneath. So they got some nice little devices to start lifting the sides up and actually causing it to form back. They actually bend it back and cause it to crease to take the pressure off of it and then pack it underneath. But these are not contraindicated, but again, it's for comfort. Sunburn, not contraindicated, but comfort. Prevent them from being reburnt again. Okay, I think we had time. You wanted time for a question and answer?
Yep.
Yep.
Any questions? I have some.
Yes, sir.
Blisters.
Blisters.
Acute blisters, where the skin's still there, or maybe it just ruptured, but the acute, soft, moist skin is there. I've seen and heard different things, and I've done different things, and really haven't had more success with one technique or another. But what's your view on that top layer of skin? Slip the 18 gauge needle in there, drain it, leave the skin?
Leave the skin, yeah. Yeah, they say leave this, right now they're saying leave the skin on there because If you don't, you're opening up that site to more infection. And it's also, you're getting down through the epidermis, so you're down into the dermis. So if you start rubbing down through there, you're gonna have more problems. So they say leave that and then put an ointment over the top. This is that be one place where your triple antibiotic would be very nice, because with the Vaseline base or petroleum base, actually a nice lubricant. Take your moleskin, cut a section out over top of that, and then another layer of moleskin on top of that, so that blister is completely protected and it has some cushion above it, some free space.
Culturing wounds or?
Culturing.
Culturing them?
Culturing.
Yeah. Are there kits that our docs here, our providers here can have in their clinic?
Mhm.
That's affordable and.
Typically, most of the labs will give them to you.
Okay.
So you can get those, they're those stick cultures.
Yep.
Call the lab, call your lab, ask for half a dozen of them to have in there for skin cultures. I would also, if you're gonna be having the skin culture ones, I would get scraping culture kits for fungal infections. Because with the fungal infections, you're gonna get that scaly stuff over the top, and a culture stick, because it has the cotton swab, is not gonna be rough enough. So you actually need a wooden stick that'll come over and scrape it and slide that in, and then they can put that underneath the microscope to find out what's going on with it.
What's your view for clothing? So we've got singlets for wrestling and gis for martial arts. Using just a little bit of chlorine when you're washing the clothes, does that seem to be of benefit to?
That seems to be a benefit, yeah, because you're gonna be using, for your chlorine, all you need is a 10% solution, and it's gonna be antimicrobial.
Yeah.
And so if you're using that little amount, you're not gonna be bleaching out color out of the uniforms. The other thing is, when you do have injuries and you get blood on the uniform, Windex with ammonia. Spray that on, it'll suck the blood right out now.
What about hockey gear?
Ozone.
Yeah, that was, I did have that as a question, but you had covered it real briefly. You had mentioned possibly spray ultraviolet light and ozone. I know has been a discussion point that we were talking about earlier. Are there surfaces in the area that
I have,
aware of?
not that I'm aware of right now. That's something that we should look at, because I know there's portable equipment around that can be moved around. That's what I'd love to have us get.
Right.
But, yeah, we'll have to look around for that. Because that's one of the big things is, because once that hockey gear comes off, it stays in the bag until the next practice and just keeps on growing and growing and growing and growing. So, yeah, but silver will help to, it's not going to get the odor out. Ozone is the best thing for getting that odor out of that. Yeah.
Any other question?
Actually, what about like, is there any type of toxic effects with the silver?
The only toxic effect with the silver that's been noted is long-term use. You can get a bluing to the skin. Now, if you had, where you might see that when you're doing it topically, is when you're dealing with some of these vascular ulcers. So a venous ulcer, arterial ulcer, or a diabetic ulcer that are slow healing, slow going. You use that because it's continuing to seep. Every once in a while, you're going to get a bluish around the wound itself. I know everybody talks about the Blue Man. I was drinking colloidal silver for years. Well, like I said, it was years, and he was making his own silver. Most of the colloidal silver that's available commercially for use runs either 180 or 160 parts per million. He was getting up to close to 500 parts per million, and he was doing it for a long period of time. And so that builds up into the skin. So, but otherwise, I haven't seen it.
Kind of on that same thought, would you also caution for excess use of the tea tree oil stuff for a topical remedy, as it's phytoestrogen and also can be reactive to sunlight?
Yep, absolutely. Yeah. Anything that I'm using for treating bacterial infections, viral infections, or anything like this, I'm using it in the same way as a prescription. I want to use it for limited time only, not as prophylactic. That's the other thing that you're going to find with silver. A number of companies are recommending it used as a prophylactic. I don't, for the simple reason that silver is antimicrobial, antibacterial, and it does, when it does attach, it goes through the cell wall, will disrupt cellular function. It can also disrupt ours, and it's also going to disrupt all our GI flora as well. Bacteria is bacteria. So if you're taking an antibiotic, you're not only disrupting infective bacteria, but you're also disrupting our internal flora as well. Okay. Now, we got a couple minutes. You guys want to come up and take a look at some of this stuff too and play with it?
And just before you leave, a reminder, sign in. If you're a doc here, grab a half sheet just to have in your record that you attended. And hopefully at some point in time it'll have some value to you. Thanks again, Dr. Williams. You've been very interesting. Thanks to the Minnesota Chiropractic Association.